Good morning, everybody, and happy
Dr.
Tuesday.
Bridges, welcome.
And Dr. Bridges is also here with us. We've actually, before we jump into the presentation, I would like to address the issue that I did make you all aware of this morning. When we woke up this morning, we received news that the FDA and CDC have paused usage or recommended pausing usage of the Johnson & Johnson doses of the COVID vaccine. There are concerns that there have been 6 reported cases of a rare and severe type of blood clot in individuals who've received the J&J vaccine. This is out of just shy of 7 million doses of the vaccine having been administered so far in the U.S., and 6 reported cases of these blood clots that have caused concern. The blood clots, based upon the information that has been released by the CDC so far, all 6 cases occurred in women between the ages of 18 and 48. The symptoms occurred 6 to 13 days after the vaccination. And as a result of this, the CDC will convene a meeting of the Advisory Committee on Immunization Practices, ACIP. The same group has provided the guidelines and recommendations on how to move forward and use these vaccines to further assess if there is any relationship between the vaccine and these cases, and to determine what the next steps may be. So as a result, we have paused using the vaccine in the county. The Johnson & Johnson doses were primarily used at our mass vaccination site at the state as first doses. Well, there's only one dose since it's a one-dose regimen. And to a smaller degree, we've also used it in a couple of other areas, including some independent living situations, homebound situations, as well as with our partners in DOCR. Now, what we also want to make sure that folks at home understand is, again, there's been 6.8 million doses administered of the vaccine. There's been 6 reported cases of these blood clots. To date, as best as I can tell, we have not received any information that any Montgomery County residents have been included in that number of 6 cases or have demonstrated those symptoms. Now, for any individual who has received the vaccine, the Johnson & Johnson dose so far, the things that you would be looking for in terms of concerns for blood clots are potentially shortness of breath, coughing up blood, and given that the particular blood clot of note has been associated with cerebral venous thrombosis, you would also be on the lookout for significant headache as well within a 2-week period of receiving the vaccine. Now, if you have received the Johnson & Johnson dose and you do develop those symptoms or concerning symptoms within the 2-week period after receiving the vaccine, I encourage you to reach out and to seek medical care and get medical guidance for follow-up. Now, any healthcare provider who happens to have a patient come in for symptoms concerning for that, we do encourage you to fill out a vaccine adverse event form, which is available on the CDC website. There will be a press release sent out by the county shortly, which will include all of that information and guidance. We also have been shared with that MDH will be putting out a statement related to this, as well as provider guidance for providers throughout the community to understand what to be on the lookout for, as well as what steps and procedures they would need to take to report said events to the CDC. So before we got into things, I wanted to address that. And of note, we originally were going to suspend the first doses at the mass vac site. However, we've been able to shift so that those individuals, today we had approximately 1,300 folks scheduled at our mass vac site. 960, I believe, were scheduled to be first doses with the Johnson & Johnson. We are replacing that with Pfizer doses. So no one who was scheduled today should have an interruption in being able to get the vaccine, and we will continue to utilize those doses as we move forward throughout the rest of the week and plan accordingly. It's also important to note that anyone else scheduled at any of the other county apparatuses, we are using Pfizer doses there, as well as for individuals who were getting second doses at Germantown. Everything else is business as usual and full speed ahead. We are not making any cancellations or changes to anyone who's scheduled to receive a dose today, just with exception of switching Johnson & Johnson to Pfizer. So I wanted to take some time to address that before we get started. Hopefully that will address questions that our folks at home have. Naturally, we understand that people will be alarmed and have concerns and be anxious, but I did want to just put that information out there. And again, as always, level set your expectations and hopefully address your concerns as you move forward. Now, certainly, if there are further questions, please don't hesitate to let us know. We will be as transparent as possible with the information that we have available that's been shared with us from CDC and the state. At this time, that's all the information we do have, but as we get more, we will certainly make that available to you all and make that available to our residents at home. Now, I will shift to, if I'm able to do it, our pulse report today. Thank you. And I was having some technical difficulties this morning, so I don't know if I'll be able to present the slideshow as usual, but you can see the slide hopefully on your screen. So before we get into the vaccine numbers, I wanted to talk a little bit about the community transmission levels and where we stand. Again, when we look at our case rate per 100,000 residents, we are at 11.4, or that was as of yesterday. And as you can see with that, that is still technically CDC definition risk of high risk transmission and remains at a higher level than where we were last summer. I do want to share a couple of additional graphs that we haven't looked at before, particularly that as it lays out the state numbers. So this is the case rate, the 7-day average case rate for the state. Now here's where we are right now. The state is sitting at 22, just over 22 cases per 100,000. When you look at our previous peaks, this peak here is the peak from the first wave of COVID cases last spring. Here's the second peak that we saw in the summer. And here's the third peak that we saw starting in the fall throughout the winter. And here's where we stand right now. So we are actually at higher transmission levels than where we were in the first and second waves of the pandemic. Not quite as bad, fortunately, as we were over the winter months, but we're still at a higher level. So granted, we do have a higher percentage of people vaccinated. Well, we have people vaccinated now. We didn't have people vaccinated at this stage, which is a little bit different, but apples to apples, we are seeing higher levels of community transmission now than where we were last spring and summer. And I want to emphasize that because that continues to guide the guidance that we are providing you all from a public health perspective as we continue to get bombarded with lots of questions about why certain things aren't open or why certain policies are in place. This is a reminder that we haven't ended the pandemic and we're still seeing elevated levels of community transmission. Now, that is also evidenced when we look at acute bed usage in hospitals as well as ICU beds. So the top marker here is our total bed usage. And as you can see, this was the first wave of the pandemic. Here was the summertime. Here's our winter months. And here's where we stand right now. So we have seen from March 8th, and March 8th is our earlier in March when the decision was made to open things up more and throughout the state, we have seen an increase in the number of hospitalizations, both in terms of the total, acute hospitalizations, and to a lesser degree, an increase in the ICU hospitalizations across the state. And these are the state numbers, not just Montgomery County. And then unfortunately, it's a little bit small here, but when you look at our test positivity, actually, as of yesterday, Montgomery County was at 2.97, which was the lowest test positivity across the state. The state's average is 5.4. And when you look at case rates by county, you can see we've got 4 counties who are in the red zone, and we're sitting at 11.43, which is, I think, 19th or 20th in terms of case rates across the state. Now, just to pivot and shift to vaccines, we've now had over 40% of our residents receive at least one dose of the vaccine, and just shy of 25% have been fully vaccinated, either receiving both doses of Pfizer or Moderna, or the one dose of the Johnson & Johnson. And we, again, have moved our prioritization at the request of the state to mimic the state prioritization and follow that schedule. And here's our numbers in terms of the number of doses administered, as well as the percent population. Again, you can see we are making significant progress in terms of the percentage of folks that we have covered compared to the rest of the state. This is our running vaccine total in terms of the number of doses administered all throughout over time. We've administered over 160,000 doses. We'll just continue to shift here. You can see here, again, the percentage of doses administered by population. Unfortunately, some of those gaps are about the same. They haven't worsened, but we continue to try to close those gaps for Black residents at 12 to 19% and Latino residents at 12 to 18%. And then this just is another schematic looking at the percentage for those who are over 65, again, recognizing that in the early stages of vaccination, it's been an age prioritization. Now that is shifted as those over 16 are now eligible for the vaccine. Just another geographic representation where we're starting to see less places, particularly those over 65. The red numbers mean a lower percentage of those vaccinated. We're seeing, even though we still see some pockets of that, they are becoming dimmer and shifting between pink to green, meaning that we're seeing closer to on the higher ends of percentage of those residents covered. And then this is just, again, looking at the percent change for those who are 16 to 64. We're seeing increases in the percentage of those by all of the races as it's become more available as the 16 to 64-year-old age groups are eligible for the vaccine. And again, we do have ways to go here. You see more red and pink zip codes that have lower percentages of that. Again, we are doubling down with our efforts as the county, working with our community partners and MHIPs and others to address that issue. And now that over the last week or so that population has been eligible to get vaccinated, we do anticipate over the next several weeks that this map will improve. Again, just another geographic representation by zip codes. And this looks at the breakdown in terms of where folks are accessing their vaccines. You can see here that the two biggest sources of vaccinations for our residents are through the county apparatus and the state mass vac sites. Pre-registration numbers are continuing to move forward. Again, we are encouraging folks to pre-register now that everyone is eligible over the age of 16 by state standards. And just to emphasize, just because you're eligible does not confirm that you will be getting an appointment right away, as again, capacity has significantly limited what we have available. I will say that before the issue with Johnson & Johnson arose this morning, due to some manufacturing issues with Johnson & Johnson, the number of doses that were provided to states was decreased last week, and there was a 33% reduction in the number of doses that were sent across the state. For example, we have been receiving a weekly allotment of 10,730 for the last 2 weeks. That allotment was cut to 7,030 doses for the local health department, and I believe 5,800 doses were supplied to the mass vac site. You can recall when the hope was that we would be doing approximately 3,000 doses a day at those sites. So that supply also has been limited due to the federal production concerns. Again, just breakdown of pre-registration. And just the last slide I want to emphasize is we continue to look at and utilize our equity framework, looking at those zip codes that have continued to be hit hardest based upon not only the historical levels of numbers, but also we continue to look at the number of cases and number of fatalities over the last 30 days. I will stop there. Happy to answer any questions. We'll turn the floor over to Dr. Stoddard unless Dr. Bridgers had anything to add.
Okay. Good morning. I only have a few updates to some of the things that Dr. Gales provided. We're sitting around 142,500 pre-registrations in our system that have been deduplicated. Of those 142,500 pre-registrations that remain, about 85,000 of them have been offered appointments already, meaning only about 60,000 or so people are remaining to receive an invitation, at least one invitation. The 82,000 will get a second opportunity and a third to make sure that they get an opportunity to be vaccinated. But I think the point being that with only about 140,000 people still pre-registered, we will need more people to pre-register to keep fueling the sites. Even with the slight delay posed by the Johnson & Johnson pause, we do expect to get through the remaining 60,000 over the next few weeks. And so we do want to make sure that we get more people pre-registered. And certainly as we talked about, just because you're eligible does not mean you will get an appointment. But obviously, being in the system is your best guarantee that you will get an opportunity to be vaccinated. In the state system, there are approximately 70,000 people who are pre-registered for the first or second preference for the Germantown mass vaccination site. Of those, approximately 65,000 are Montgomery County residents. And so obviously at the Germantown site, the vast majority of vaccine doses will end up in the arms of Montgomery County residents. And obviously about 5% of the doses will be shared with our statewide residents. And that may change over time as people pre-register more and more with the at the state site. We're pleased with the progress that's happening at the state site in spite of the lack of increase in doses that we saw week over week. We saw a slight increase, but not to the point where we were able to do that 3,000 a day that we had hoped to do. But we're hopeful that over the coming weeks, with the correction of this Johnson & Johnson issue, as well as expansion of the other vaccine opportunities, that will be well placed to be able to ramp up to that volume by next week if we were able to receive the vaccine. So the other thing I want to note is we've been doing a lot of work with other partners. We did do a childcare workshop last night with Ms. Barnes and the Children, Youth, and Families team. Ms. Arnaz organized that meeting, and so we had a bunch of providers on that answered questions about the vaccination program and the efforts being done to vaccinate childcare workers, as well as keep childcare programs safe and expanding as we go into our recovery programming. We also have another economic recovery workshop with the business community on Friday. Mr. Fletcher from the County Executive's Office is coordinating that, but I believe Dr. Gales and I will both be on that call and sort of answer their questions about the aggressiveness of reopening, vaccinations, and all the other things that are to be considered. This is a series of workshops that we've done with the business community to make sure that they understand what's happening with reopening and make sure that we can support them in understanding exactly how they can get their employees vaccinated, all those things. So on the essential employee front, we've had in our pre-registration system just about 5,500 grocery store workers. And I believe of the grocery store workers, about just under 3,000 of them have been vaccinated so far. All of them have received at least one opportunity. We'll continue to receive additional opportunities to come in and get vaccinated. And so we're moving through that group, but obviously if you're a grocery store worker out there and you're hearing this, please do make sure that you're pre-registering, and we'll get you in as absolutely as quickly as we can to get vaccinated. So we have been doing, we did a third in our series of vaccinations in our correctional facilities, and those have been incredibly successful. And obviously, I think we've covered the majority of our detainees, and obviously we had already covered the workers in the correctional facilities. Those obviously represent significant concerns in terms of outbreaks, but we will continue to work in the correctional facility environment to provide vaccinations as they are available and as there is need. So I think one last thing I'll touch on is that the CCC, the census teams, continue to do their work throughout the communities. They are doing events pretty consistently. They've got a good cycle going. There's a whole bunch of materials that they've now working on getting translated into multiple languages to expand that and have better education and understanding for our community. I do know that they are seeking through the Volunteer Center some additional Spanish-speaking volunteers, and would encourage you as that message goes out to please share it across across the board to allow for further recruitment. Hasn't slowed any events to this point, not having as many as we would like, but obviously I think that to really fully and robustly have multiple opportunities, we are looking for a little bit more help. So with that, I will stop and we can certainly take questions.
Thank you so much. Councilmember Katz.
Thank you, Mr. President. I just wanted to note that I did get my second shot on Friday. I went to Germantown, Montgomery College in Germantown, and they opened a few minutes late. And of course, when you're standing in line, I had an appointment, obviously, but when they opened a few minutes late, everybody there felt that every second was a month. I mean, everybody was, tapping their foot pretty good, when they opened and when they opening. But once they opened, and they probably opened maybe 10, 15 minutes late, but when they opened, they were as efficient as they possibly could be. And as I say, I was getting my second shot of Moderna, and they had people that said, if you're getting your second shot, you stand here. And if you're getting your, first shot, it's going to be Johnson & Johnson, and you stand there. But it really was efficient. And I sincerely want to thank everybody that's been involved with this to get us there. I also wanted to mention that a friend of mine who I went to high school with on Facebook this weekend put on that he had gotten 2 shots, the second shot back in February 19th, and he got COVID. And I knew that our experts on these discussions, we'd had this information, that even though you get the shot does not mean that you are exempt from getting COVID. I called him, and he's quarantined for 10 days and he's doing fine. And he had a fever. He didn't have anything beyond that. But I did want people to know that these things can happen, do happen. And it certainly makes it real when you know someone, when it's happened to them. And the only question that I have is that after you get your shot, you wait 15 minutes to see that there's no immediate adverse reaction. Have we had anyone, or how many people have we had that during those 15 minutes has had an issue? Are you aware of the people that have had an issue during that time?
Thank you, Councilmember Katz. I'm glad that you had a good experience and getting fully vaccinated. And we will share that feedback with the team. As it relates to adverse reactions, I think as of a couple of weeks ago, we had 1 or 2 vasovagal type episodes, but no severe allergic reaction type episodes. And again, as best as I can tell in terms of the reports that I've received, we've not had any documented cases of severe allergic reactions secondary to any of the vaccines that have been administered by the county so far.
Very good. Thank you very much. Again, thank you all for everything you're doing. You're saving lives. And with that, Mr. President, I'll turn it back over to you.
Thank you, Councilmember. You reminded me, let me jump in with just 2 quick questions. Dr. Gales, I'm glad to hear about the increase in our residents pre-registering. Is that across the board demographically? Are we seeing that increase among Black and Brown residents as well?
I'd have to take a closer look at that. I do know that there have been significant efforts, again, to highlight with our community partners, including our minority health initiatives and programs, who have been working to do just that over the last several weeks. So I would not be surprised if there has been a comparable increase across the board, given the efforts that they have undertaken. But I'd be happy to look at the data again and provide a fuller answer to you after the briefing.
Thanks. Glad to hear that. Obviously we need to keep an eye on that as well. And then also, I was at the Silver Spring site yesterday and learned that it was closed for the day because of, I guess, vaccine availability. I was glad there was no crowd outside. Can you talk about how those folks were notified? And then also I'll just add, I was concerned that there was one family that showed up, a young mom with a couple kids in tow, and car seats and the whole thing, who had been sent there from, she said, 2 sites in Rockville and somewhere else, told to go to Silver Spring yesterday. And then, of course, no vaccines were available. So can you talk just generally about how are people notified when changes like that are made?
Well, we actually don't schedule clinics if we don't have doses. So I can only speak from, I'm not sure if the individuals were sent to us from other sites that had nothing to do with the county apparatus, but we schedule our clinics based upon the availability of doses. And if there is a situation where we do have to cancel, so for example, this morning, our original strategy until we were able to shift doses around was that we were going to have to cancel those first doses, is that we would send notification to anyone who is registered through an email, and then as needed follow up with a phone call to let them know that their time would be canceled. So as it relates to the Silver Spring incident, I don't know all the details, but what I would say is we wouldn't schedule a clinic,
Right.
unless we have the doses available to do it. And for the family that did show up, we'd love to find out more information about what happened and how they were sent there, and how we can potentially help them get their vaccine schedule.
Sure. I didn't get a lot of details. She didn't want to stay. She just wanted to move on. But anyway, I was curious about that. I'm glad to hear they're getting a phone call as well as an email. Councilmember Rice.
Thank you very much, Council President, and thank you, Dr. Gales, Dr. Stoddard, Dr. Bridgers, as always. I'm going to jump right in with the vaccine playing a key factor in terms of some of our decisions around moving towards opening, lessening restrictions, et cetera. How does Johnson & Johnson's revelation of restrictions, and we just got the guidance, thank you for sending that over, from MDH, saying that they're pausing everyone from distributing Johnson & Johnson vaccine until further notice. So with that being said, how does that impact our plans to continue to lessen restrictions and continue in a direction where we thought that the more people vaccinated provides herd immunity, gives us all the things, all in the positive direction? What does this mean for us when it comes to potential appointments that were set up, all of that? So,
well, the first thing is, interestingly, if this were going to happen, now obviously, now let me be very clear, none of us wanted this to happen and want this to happen, but have full faith and confidence in the governing bodies to do the necessary, thorough, and comprehensive review to determine if there is any type of causal relationship and to provide us with the guidance to move forward. And this is similar to, if you recall, during the actual research studies, there was a pause, and because there were several episodes and events noted, they were cleared and they moved forward. And so we expect that they will do the due diligence and come up with safe guidelines and procedures to move forward. Now, if this were going to happen, because if you recall also, we knew that there would be a reduction in Johnson & Johnson doses anyway. And so, for example, the mass vaccination site that was our primary place here in the county where we were going to use those doses had already been sent an increased supply of Pfizer doses anyway, starting tomorrow as a part of the weekly allotment. So we had fully expected to be using primarily Pfizer at that site beginning tomorrow. We just shifted things up a day early to be able to make sure that we didn't have any interruptions in those who had appointments scheduled. Now, it will cause the need to shuffle some appointments potentially that have been scheduled later in the week. Based upon that capacity, we will make the necessary adjustments to the schedule, again, to minimize the interruption and delay in any individuals who may be scheduled for those vaccines to get them as quickly as possible. On a global perspective, as we had seen the actions taken late last week with the reduction overall, is the fact that there will be less supply of doses available. I think everyone was banking on there being a windfall of Johnson & Johnson doses available to increase capacity across the board. And so with that not being there, that then, continues to have some capacity issues, and there will be a shuffling of doses, if you will, to be able to compensate for that across the board in different sites. Now, as it relates to how we move forward in terms of reopening, at least for the guidance that we're providing to you all on a local level, is that yes, it's going to take that the capacity restriction or the capacity limits will cause us to take a little bit longer to get to that higher percentage of being able to get more residents covered. Now, I think that is, or at least again in the guidance that we provide to you all from our perspective, the percentage of individuals covered by vaccines is an important, I think, contributing factor to those conversations about reopening. because that has a potential role to play in terms of the number of cases that we see in all those other community transmission measures, including our test positivity, hospitalizations, and cases. Right now, our numbers are holding steady. And I know some folks would say, well, that's the time because the numbers are good. Why don't we open everything up? It's actually the time, at least from a public health and epidemiologic perspective, to hold tight, because further reopening would actually potentially compromise the numbers where they are, as we've seen in other areas in the state, and we've seen in other areas across the country that have been more liberal in terms of their reopening strategies thus far. So I say all that to say that lower supply of vaccines available would increase the amount of time it takes for us to get to a higher percentage of residents covered, not just those over 65, but the general population, particularly as we're seeing higher numbers of those who are in that 18 to 64-year-old group be the main source of our new cases of COVID. And again, particularly in the setting of a higher percentage of variant strains being available, or not available, but being, distributed in the community.
So, and I appreciate that. So it brings me to the conversation with the state of Michigan, to where the state of Michigan, based on their higher number of transmission cases, said, hey, give us more vaccine, to which then the White House and health department said, no, in fact, you need to shut things down. And that was their response yesterday. Dr. Fauci and others were on the call. What do you say for us when we see an increase in the state numbers? Because again, we don't have borders that separate us from any areas throughout the state of Maryland. Where should we go when it comes to seeing, as you showcased in your presentation, that 7-day average to where the state is ramping up to what looks like another spike?
Well, what I would recommend from a public health perspective locally is that we stay where we are. If anything, think about moving back as opposed to moving forward. I think the opinion of the health officers was very clear before the governor made the decision to open things up, that we did not think that would be a wise idea. And unfortunately, we have seen, as we demonstrated with the charts that we showed in the early part of the presentation, that since the decision was made to open things up more significantly, we have seen an increase in all of the indicators that we followed throughout the pandemic: test positivity, case rates, hospitalization rates. And that's troubling. And quite frankly, we did not support that. And I won't speak for all of my other fellow health officers. I'll just speak for myself. I think that there should be more of a conversation at the state level in terms of what actions can be implemented to curb and keep the curve from increasing at the rate that it is doing right now. We have seen, I know that there was commentary that the thought was that it was due to travel. The reality is it's due to community transmission locally and regionally based upon an increased percentage of variant strains here. And I think that this is a time where we're seeing cases increase. We're seeing families continue to be hit. And I think it's a time where we need to put science and clinical evidence at the fore and remove and diffuse politics from that decision and determination to make sure that we're having the types of discussions we need to do to come up with the strategies to keep our residents safe.
Let me just. Oh, sorry. Go ahead, Dr. Bridges, please.
The only thing that I would add to Dr. Gales, as he's indicated in all of his charting and graphs, is that we have and we still have the capacity to test folks. So if you feel that you've been in close contact or you've been exposed, the way we maintain and contain a community transmission is to get tested and have folks isolated. And so I encourage all. We've had conversations at the municipal level and with our public school systems and our private and independent school systems, where we've set up testing clinics specifically to get folks tested so that they will know their status, if they're asymptomatic or symptomatic, and to have folks isolated. So I just wanted to share with the listeners and the viewers today that the county still has the capacity and we still are testing. So don't throw out the testing with the vaccination, and we still need folks to get tested and to isolate if unfortunately their results come back positive. The turnaround rate is still between 24 and 48 hours, so folks should continue to get tested, especially if they are out in the community a lot.
Dr. Bridgers, your last statement was actually the perfect segue into schools. Last week, I brought up Dr. Gales, Dr. Stoddard, Dr. Bridgers about how we're getting close to this massive reinfusion of students back in schools. I've been apprised of Daly Elementary School and a true outbreak by definition in terms of what has happened. We're also exploring whether there was actual classroom transmission based on that case. Can you give us a little bit more information about that? And then also whether or not this gives us pause to what we're doing starting on April 19th.
Well, I think what I prefer to do, Councilman Rice, be happy to follow up with you and have a discussion with our contact tracing team to get more information. We have had a couple instances. For example, we had a situation yesterday where there were 2 classrooms at an elementary school where we did a pooled sample. And for the folks at home, the pooled sample means that everyone contributes to one larger sample, and if it comes back positive, then all of the individuals who contributed to that sample would then need to get individual tests. And so we are, getting in further information and completing that process and that investigation. And so we'd be happy to follow up with you offline following this conversation when we get more details so that we can answer your specific questions. But yes, we certainly are continuing to follow up in any of those cases that are positive, as well as those conditions that have been reported to us that are COVID-like illnesses, and providing guidance to the school systems in those cases.
Thank you. And then last but not least, remind me as we enter into, because the last part of this is my last question, Mr. President. Normally I don't ask a lot, so I apologize. We're leading into graduation. Folks are looking to have graduation parties. We've heard that some schools are actually doing graduations this year. Last year, we forewent that for the majority of our public schools. Weddings, all kinds of other celebrations. Remind folks as to what the guidance is for gathering group sizes, because I think that, again, we haven't talked a lot about that in terms of what the limitations are. And so I think that folks, again, are relaxed based on the fact that we have vaccinations, which seem to be out there and still moving, even with the, little bit of a backward slide with Johnson & Johnson, but folks are feeling much more comfortable. And I don't think that they're still thinking about, to Councilmember Katz's point, the risk that's still out there when it comes to contracting COVID, regardless of whether you've been vaccinated or not. So what is our current guidance when it comes to gathering sizes? What is our current restrictions and limitations, just to make sure that folks at home, for the millions that are watching at home, understand what's going on?
Well, our capacity limits depend on situations, but globally, indoor capacity is set at 25 and outdoor capacity is set at 50. And within that, there's certain, for example, we do have for indoor restaurants, for example, 50% capacity, but it's tied to physical distancing and making sure that's enforced. So that number may be a little bit variable in terms of what the raw number is outside of percentage within that. And, to the point that you made about graduation, I know that there's continued to be extreme coordination with members of our planning groups and logistics teams. I know Dr. Stoddard participated in the call yesterday with MCPS to work through graduation guidelines, and the team has been looking at other jurisdictions, including DC and others, who have policies out to study those, to come up with a plan not only for our public schools here, but also for the non-public schools. And I believe I've seen at least one draft of those so far, and we'll be finalizing those hopefully in the near future to be able to share so that they can plan. And I think it speaks to a larger issue here is we are doing everything we can to support activities to move forward, to return to some semblance of where we were pre-COVID. And in a lot of those instances, so for example, you mentioned we didn't have graduations last year. It's different. So we're trying to help support those activities move forward, but we also need folks at home to be patient and understand that even moving those activities forward, at least in the short term, they may not be back to 100% of what it looked like before, because we want to make sure that we are continuing to provide guidance to minimize any risk of transmission and exposure. And consistent within that, we're trying to provide guidance in the real time that's shaped by our reality right now. It's hard to speculate where we will be 2 to 3 months or 4 months or 6 months down the road. And we do, in providing that guidance, we're providing real-time guidance, but we're also making sure folks understand that if situations change, there may be the opportunity to expand those provisions or do things differently compared to what the guidance we're providing right now.
Well, thank you very much, Dr. Gales, Dr. Stoddard. Oh, no, go ahead, Dr.
Yeah,
Stoddard, please.
I was just going to chime in on the one thing we did here, and I think this is important for all schools thinking about graduation now, is there seems to be some confusion around the CDC's 3-foot recommendations for in classrooms. That would not apply to a graduation, just so we're very clear. Those recommendations apply to cohorted students in a singular classroom that don't exchange. The graduation ceremony is a very different kind of scenario. So just for the schools out there who are doing graduation planning now, we're going to produce some guidelines for you, but don't be thinking about that 3-foot guidance, whether it's outdoors or not, in terms of the separation between graduates as well as their family members. So it makes the spacing requirements substantially different, but you should not be proceeding with a 3-foot distance in graduation ceremonies.
Along those lines, I would just caution us because folks pay very close attention. And a stadium filled with proud parents watching their child walk across the stage is no different from a stadium full of proud parents watching their child kick a soccer ball into a goal or hit a home run or do any of the other kinds of things. And so when we're talking about leading with safety, if we're going to start making those exceptions then run across the board and aren't just for graduations. And I'm speaking as a parent whose daughter stood in front of a banner and that was her graduation. So I get it and understand where parents are, what they'd like to see. I've experienced the heartache of that being her only thing. And I know what it means for kids. And so I want to see that happen. But I also understand that if we do this, then everyone's going to ask for it for everything else that we do. And there's really no justification from a safety perspective if we're doing it for this, why we can't do it for that, i.e. soccerplex, i.e. other kinds of things. So I just, again, want to make sure that we're thinking about this in the context of the direction that we're going in and the message that we're sending to our community about what is safe and what isn't. But thank you, and I look forward to continuing to follow up. Thank you, Mr. President.
Thank you. Council Vice President Albornoz.
Thank you. Start with 3 observations. The first is last week, as a number of my colleagues and I had the opportunity to visit the Germantown site, and I was blown away. It was just an extraordinary operation. I know one of many across the entire county and across the state, but that really was a strong collaboration. And while all of us would have preferred to have had that opened weeks earlier, the good news is it is open. Second observation is we do have such a strong partnership here between our hospitals and our other providers to be able to work collaboratively to address the Johnson & Johnson issue, to be able to continue to provide the vaccinations and not miss a beat for those folks who had already been pre-registered is a testament to the public health team and Dr. Stoddard and Dr. Gales and Dr. Bridgers, Nexus Montgomery, and all of the clinics and our state Department of Health providers who are working collaboratively across the board. And my third observation is, Dr. Gales, thank you for your very positive bedside manner in explaining the Johnson & Johnson situation. The way that you calmly went through and described what understandably are raw emotions from a number of residents and constituents who received the Johnson & Johnson vaccine is so important right now. So that it doesn't lead to any sort of panic or just putting this in context is critical. And I know that this caught us all a little bit flat-footed, and it is essentially hot off the presses. And so I hope that the state or the CDC provides a very clear direction and phone number that if people for whatever reason don't feel comfortable or don't have a primary care medical provider that they can go to, that there is a place that they can go to access information and to alleviate any of their concerns. I think that's important because I agree with Councilmember Rice. And in the first place I went to is operationally, what does this mean? And I guess the silver lining is that because Johnson & Johnson had already been scaling back, it's not as big a bump as it maybe it could have been. So that's good news. But where my head went next, and I know all of you on this call probably did as well, is for those folks that were reluctant to get the vaccine in the first place, this is a punch in the gut. Because already this morning, got a text message from a good friend who I'd been leaning heavily on for a couple of months to get the vaccine, and sent me about 15 angry and upset emojis this morning. And so I think it will be important for us to work collaboratively and redouble our efforts to educate the public on the efficacy of the vaccine in general, and that the pros so significantly outweigh the potential cons. And I think it's going to be important for us to deliver that message this week, over the next 48 hours in particular, because the social media has already become hot. And in a number of immigrant circles, there was already a high degree of misinformation out there. And now I'm starting to see a lot of "I told you so's." And so I think if we can follow up this conversation as soon as possible, Dr. Gales and team, with working with the communications folks. And the great news is we have such a strong infrastructure already, and the folks who are already going out through the census team, but working collaboratively to get the message out, because we all have various communication tools within our respective offices as well, so that there's a consolidated message using that same bedside manner that you presented to us at the beginning of your discussion today. I think is going to be really important. So I'll follow up with your team and all of my colleagues, I'm sure will as well, on making sure we get the word out that things are still safe. And we need to continue to move forward, which I think is important.
If I may, council member, while we've been on this meeting, actually the FDA and CDC have been holding a media call on Johnson & Johnson. So I expect they're going to be really out there in front of the message. And a couple of key takeaways that I'm seeing from that call are: number one, they only expect this pause to be a matter of, quote unquote, a matter of days. The advisory council is having an emergency meeting. The ACIP that we talked about before is having an emergency meeting for tomorrow, and so I think that will obviously be important to move forward. But I think that number one, I think Johnson & Johnson will be utilized, and what I think is happening right now, and this is what's coming from this media briefing, is that they're really just trying to get guidance out to medical providers to be able to look for signs and symptoms as Dr. Gales described, so that physicians and other trained medical staff can be prepared to, if we do see side effects, that we can manage those. But I think it's really important context to understand that there are a number of medications that do cause risks for blood clotting, and things like birth control have a side effect risk of blood clots over a prolonged use. And so many medications that we utilize can rarely have side effects, and in this case, this is less than a one in a million chance at this point, from what the data shows so far. And so I think it's just important to contextualize that the risks of COVID are a lot higher than 1 in a million. We've seen that borne out in Montgomery County. We've seen that borne out throughout the country and across the world. And so it's really about risk communication and understanding the relative risks. The risk of COVID is quite high. The risk of getting a side effect or a negative impact from COVID is quite high. And so when we're talking about, it's not a no risk or some risk, it's a lot of risk versus a different kind of risk. And so it's really about understanding exactly what the environment that we are living in is. And just because you choose not to take a particular vaccine does not mean that you have no risk, because now you're potentially going to expose yourself to a deadly infectious disease.
I hope somebody was taking notes. That was good, and exactly what I'm hoping we identify and glean in very clear and concise messages that's translated in multiple languages, that we can get out as soon as possible to counter some of the inevitable doubling down on the skepticism side of the vaccines, which I think is great. And last 2 points. The good news also is that the numbers have held steady here, and it is because we've been more aggressive than other jurisdictions in continuing to hold the line and being much more deliberate in making decisions on how we open. And needless to say, especially over the next few weeks, we need to continue to do that. I do think post-June, as things improve and, for the coordination of some of those items or events and gatherings that are out there, we looking a couple months in advance and helping folks begin the process of planning those potential events, acknowledging at any time we can move up or move down. And this council has done that aggressively in partnership with the executive branch. But I think as we make proposals for 2 months from now, assuming things hold true, it's wise for us to continue to be deliberate, but thinking about, a couple months from now, I think is important as well. So I appreciate this conversation and know that we're going to continue to revisit all of these orders on a weekly basis as information becomes available, as situations arise. This Johnson & Johnson situation is the latest. Hopefully won't slow us down too far, but it sounds like the news is better than it could have been. So with that, I yield back to you, Mr. Council President. Thank you.
Thank you, Council Vice President. Yes, we've seen Dr. Gale's reassuring pediatric training in the past, and it's definitely helpful in this situation. Councilmember Joando.
Thank you, Mr. President. And as always, Dr. Gales, Dr. Stoddard, Dr. Bridgers, Dr. Kroll, your whole team, all your teams, thanks for all the work that you do. You woke up to, I'm sure, you probably have been up all night. We woke up to the news, but you've probably been dealing with it about the Johnson & Johnson. We were already dealing with the news that we were going to have a smaller dose amount because the states had received less from the federal government. And then we couple this, on top of it. And I'm glad we were able to move quickly. And it speaks to the partnerships we've developed with Holy Cross and the communication to kind of backfill so everyone who's in line gets their shot today. And I'm really appreciative, as are our residents, I'm sure. But the issue of the fact that the same week, here we are on Tuesday, yesterday, we supposedly made everyone 16 and up eligible for the vaccine. The same week, we get the lower amount overall from the federal government, from the state, which means we get a lower amount. The same week that Johnson & Johnson has this issue, I continue to be concerned, and I know you are, and I'd like you to comment on this about the decision to move forward in this way, and the messaging that it comes with it. Because obviously we want everyone to get vaccinated, and we want to send a message that pre-register, go when you get your appointment. I know many of us have gone this week. I've got my card here. I two stamps on it, and I know many of us have done that, and we want to encourage that. But I'm concerned about, with all these things going on at the same time, that it actually makes hesitancy worse, in that if you get frustrated in the process, if you don't get an appointment right away, and or you watch the news and you see what happened with Johnson & Johnson, and or you already were worried about AstraZeneca, even though it's not here. As you know, a third of our residents are born in another country. And for example, in my father's home country, Nigeria, AstraZeneca is the only thing available. And so all the family members are WhatsApping about, don't take AstraZeneca, the vaccine, it's got all these problems. And that translates to what's happening here. So if you have a comment on how we counteract, this issue, particularly for our, communities of color and folks that may want it or may be on the fence. I just want to allow another opportunity. Are you concerned about that? And our targeting equity strategy, because, we've tried to take actions that the governor got in the way of, unfortunately, to target even more. So I just wanted to allow you to say something about that. And do you share that concern?
Well, I'm happy to add my 2 cents and others chime in. I think that I think those of us in public health share your frustration in terms of what seems to be a significant level of rigidity in terms of decisions that are made and not really using science to say maybe the decision we made was not the right one and we need to pivot and do something differently. And that's been tough to watch. As a clinician, I've never practiced medicine that way to say, I've put in a treatment plan and the labs are telling me it's not working, but I'm going to stick with the treatment plan because I decided to do that and it's going to be right. We're trained to say, okay, the data suggests maybe that wasn't the right decision. We need to do something differently because at the end of the day, it's less about whether I'm right and more about protecting the patient and making sure they have a good outcome. And I think that in the last several weeks, we've unfortunately seen multiple instances where there has been a lack of reflection and accountability on that to say maybe some of these ideas and strategies that have been put into place are not effective at keeping the case numbers down, and there needs to be a pivot to do something differently. And I think that has borne out in terms of the level of reopening across the state. I think it has shown in terms of some of the earlier strategies in terms of how doses were allocated to different communities without having significant penetration into communities that they were designed to help, and effective strategies to remove the obstacles that continue to prevent folks from being able to access the vaccines. So I would say those continue to be issues. Hopefully there will be a little bit more agility around those from policymakers at different levels to acknowledge and maybe change some of those strategies. On a local level, again, the guidance that we're providing to you all continues to try to promote those strategies as best as possible. When we do find out new information, to pivot as quickly as we can to say, okay, there may be allowances and there may be best practices that support moving forward in a different direction to change the approach that we have so far.
I appreciate that.
If I may, my feeling on this is federal, state, local, municipal. I would encourage people to make decisions based on what is and not what we hope to be or want to be. And that's true about vaccine allocation as it is in reopening. Just because you want things to be better does not mean that they are better in all cases. And just because you want there to be more vaccine doesn't mean there will be more vaccine. I think it is more prudent to plan around what is in front of you and not what you hope or someone tells you will be around at a certain time, because you're not the person who has to stand in the front of the line and say, no, we don't have the vaccine for you, particularly at the federal level. I mean, if you're making commitments that we're going to be at a certain place, you better be real confident we're going to be at that place, because you're not, the person at the front of the line, the person in public health who has to say, no, we don't have your vaccine today because it didn't get delivered from the federal government. It's easier for the federal government than it is the person who's standing in front of that person telling them, no, you don't have a vaccination today.
Well,
and so I think it's just really important that we understand federal, state, and local. I really wish we would be more focused on what we can commit to based on what we have instead of what we want there to be.
I'm so glad you said that, Dr. Stoddard. You said it. You're 2 for 2 on saying it more artfully than I could. I think Councilman Robin has pointed that out. The expectation gap and how the point I was trying to make is that leads to more hesitancy when you set people up that way, and particularly for our communities that we want to get vaccinated, we're trying to encourage them. Councilmember Hucker talked about the woman who had toting her kids in tow, going to 2-3 places. Does she go and do that again? I don't know. There's a whole set of people who really need this. And if we're not setting realistic expectations and we're taking away authority of locals to target our doses to those communities and have innovative strategies, you're tying both hands behind our back and then setting an unfair expectation that's going to cost people health issues in their lives. People who really want to get it are going to get it. And there's a large population that really needs it that's in that middle. So I appreciate you articulating that. We'll continue to explore with you as the Board of Health, different strategies. We continue to encourage people to go out there and do it when you're eligible. So thank you, Mr. President. Thank you for your work.
Thank you. Councilmember Reamer.
Thank you. Okay, I wanted to ask a bit more about the pre-registration statistics first. Dr. Stoddard, you recited them, but I couldn't quite catch what you said. can you restate them, please? Let's just start with
Yeah.
that.
Yeah, so as of Monday afternoon, we have 142,512 people in a pre-registration system for whom there is not a vaccine. So we've deduplicated from the state Immunet system those people who were in our system but already got a vaccine. So we have 142,512 people who remain without a vaccine and in our pre-registration system. Of those, approximately 85,000 have been offered appointments already. And the remainder are awaiting appointments because they would fall into the 16 and over adults. We end up sending, we've got about a 50% or so fill rate. So when we send out, say we have 1,000 appointments, we'll need to send out about 2,000 offers to fill those 1,000 appointments roughly. And so obviously we're getting the local allocation this week was approximately 7,000 doses. The mass vaccination site is 5,850. Of that, 2,100 will come from our local pre-registration list. So in total, about 9,100 doses will come from our Montgomery County pre-registration list. What that means is we'll need to send out roughly 18,000 invitations to fill those 9,100 slots roughly. And so looking at the fact that we've got about 140,000 people in our pre-registration list, of which more than half of those have been offered opportunities already, we're 18,000 a week, and this is obviously a down week. And in future weeks, we're hoping it's 25,000, 30,000 invitations a week. We will blow through the remaining 60 plus second opportunities for the 80 who have already gotten it over the next few weeks. And so, I think on Sunday was last day, we had 1,200 new pre-registrants on Sunday. So that gives you some context for approximately how many we're seeing come into the system. We're processing people on a weekly basis faster than we're getting new pre-registrants, which means we are going to burn through our pre-registration list certainly over the next month.
Okay, that's really helpful. I mean, it's a good problem to have, but it's an urgent problem as well. And you've already shared previously, but we need to do a lot more to generate pre-registrations in our harder hit communities. What can you share about the status of the door knocking campaign, the census machine that we were intending to apply to vaccination registrations?
Yeah, we've got a whole series of events. I've got a sort of a semi list in front of me of specific events, but then also, as you alluded to, there's more sort of transient door knocking type events where we're going around to neighborhoods. So we've had events, I want to say 3 or 4 times a week across the various initiatives through the CCC, the census teams, as we refer to them. There are events, certainly there are events just on the 10th. There's another event today at Mount Calvary Baptist Church. There are the Wave Community on the 24th. I'm just going down the list, sorry. Kingdom Fellowship, Holy Cross event will be on Friday.
Okay, so
yeah, there's a whole series of events and opportunities that
there's a series of events, but that also doesn't sound like that much. So I think we could put out an open call here, and we probably should all do this. Community partners, if you can help us generate registrations, we need your help. And we need more events, we need more emails to PTA listservs and church groups and soccer lists. Whoever has a list, we've got to get the word out about pre-registrations because we're running out of pre-registrations. And again, I hope we are now, and I'd love to see a report as we move forward, knocking on doors in hard hit communities, going door to door in residential complexes, talking to folks, signing them up right on the spot, for an appointment. The fact that we're running out of appointments potentially soon, brings me to an issue I just floated. I just wanted to float it here, in a public setting. I think it would be smart for us to vaccinate high school students who are eligible to be vaccinated before they leave for the summer. And it could be a logistically simpler way for us to reach a large population, strong representation in our school population of our minority communities. So, it solves a lot of issues. And of course, we know that that's a population now that is perhaps driving transmission at a higher rate as well. So again, I just encourage us to work with MCPS on a game plan for administering doses in partnership with the school system. I want to just really sign in on Councilmember Albornoz's broad framework here. We need to be thinking about the summer. President Joe Biden has laid out a hopeful expectation for this country that July 4th is going to be a different kind of day compared to the pandemic. And by that time, we will have made so much progress through our vaccinations that the threat will have substantially subsided. And I think it is so important to have these, possibilities ahead of us, to believe that there is a better day coming soon. And it is coming. It's coming. Another 6-8 weeks of 6,000 Montgomery County residents getting vaccinated a day is going to have a big impact. You can look at the UK and you can see what the benefit is in terms of transmission. When you get a high level of the population vaccinated, you are able to suppress the cases. And we hope to be there, and I'm confident that we will be there this summer. Fortunately, there have never been any issues with Pfizer or Moderna and their manufacturing. And, nationally, the J&J, the White House apparently has said that it's only 5% of doses. In Maryland, it's only been about 7% of those who are fully vaccinated. Actually, it might even be, it's about that, maybe less. So it hasn't been it's been really important, but it's not, anyway, it is what it is. It's 7%. We are on a path to beat this thing. We're not there. I strongly agree with Dr. Gales about, hold tight. Like, what we're doing is working. We're plateaued. We're not surging. This is not the time to be opening things up for now, but I think it is a time to be planning for a different summer. And I think that's important. Now, I'm not saying we should immediately start, doing who knows what, but those entities that need to plan for the summer need to be able to do that. And so, that leads into a subsequent conversation we're going to have about summer camps. But I would generally look at that more broadly and make changes that we know need lead time. It doesn't mean that you can have a greater allowance today, but it means you can plan for something this summer. And then, hey, if we can't do it, we can't do it. At the end of the day, we're not going to just proceed with it because we said we thought we could. We're going to hold back. But there is a possibility of, so just in that general sense, like with sports and camps, I would envision that this summer, if we stay on our current path, like, we won't have spectator limits at sporting events this summer. We won't have to worry about, people gathering outdoors. Like, that should be the case. So I don't know. I don't think we need to talk about closing the schools again. We're far beyond that. And the CDC guidance wouldn't support that anyway. But I just think we're moving in the right direction. I think we've struck a good balance here with our level of openness versus closure. We're getting results. The results exceed the state's results. And we just hope that the variants that probably are burning up other parts of the state, that our vaccination campaign will outpace them. And thank you, Dr. Stoddard, for your comment about what you think might likely happen with the J&J. That was informative. Makes me feel a lot better about that possibility. So, all right. So I don't know. I don't have any other question, or if anyone, Dr. Gales, if you'd like to just, thanks.
Sure. I just wanted to chime in before moving to the next speaker. So I agree with you, Councilmember Reamer, that the world that you have painted is hopefully the reality for us in July. We just don't know if that's the case. That looked like that was going to be our reality last summer, and that was not the case as months move forward. And so I would say, the guidance that you all will continue to get from public health will be, here's where we stand right now. Here's where we can speculate how things will look, but we don't know, as was Councilmember Jawando mentioned, we woke up this morning with a complete wrench into what we were hoping to do in all of our plans in terms of achieving those levels. And so I would continue to exercise caution in terms of the guidance that we put out in terms of helping plan for activities. Now, in the group that we meet that meets regularly to review proposals and those kinds of strategies has provided feedback to groups in terms of planning to say, look, here's where we stand right now. Here's the best case scenario in the future, but here's what you should be planning on, and set up contingency plans should hopefully, yes, we do increase vaccination. We see community transmission levels come down where you can expand capacity and so forth. I just think we have to be careful, because if you pick one activity to make provisions about, you have to be, I think, universal in terms of looking at how you look across the board. Similarly, quite frankly, to if you make allowances for one or two sports, you've got to make it for every sport across the board in terms of putting those guidance in. So I would just exercise continued caution in terms of how we apply that guidance. And I know that I know this comes up because there will be a conversation about out-of-state participants in summer camps and those kind of things. We've put forward the guidance where we think we can help support planning right now. And in a best case scenario, if lots of dominoes fall and align, then you could move forward, or we would recommend moving forward in some of those other areas. But quite frankly, we're not there yet to do that. But again, you all are the Board of Health, to make those determinations, but that's just the guidance that we will continue to provide from public health.
Understood, and thank you. Again, I just want to say, what I'm describing here, I think, is our need to allow for planning for a summer that is better. And then if it doesn't come to pass, it doesn't come to pass, and we'll know as we go through. But I think we can avoid the outcome of things are good in June and July, and it no longer, and people could have had a grandkid visit them and enroll in a summer camp, and they can't. It's too late. The slots are all full. Well, anyway, we'll get into that when we get into it. But so I'm talking about things that require lead time, an event, a tournament, whatever it is. It's going to happen this summer. It's not going to happen now. How can we make provisions for that? Okay, thank you.
Thank you. Councilmember Glass.
Thank you, Mr. President. Thank you, everybody, for the good presentation. And the information that you've shared makes me feel like we're in a line dance, taking 2 steps forward and 1 step back. And the headline being that 41% of Montgomery County residents have at least received 1 dose, and 24% have been fully vaccinated. Excellent news. And again, it's a testament to the organizational capacity that you have quickly stood up, and all of us in county government advocating, and state government from our Montgomery County delegation advocating for more doses here in Montgomery County and a mass vaccine site. And then the step back is the community transmission rates, and I appreciate you sharing it with us in the manner you did. And I know you do that every week, but again, it's particularly acute this week to just really see where we are. in relation to where we have been, just 9 months ago. And then I'm not quite sure where I am in this dance, but the other information that you shared, 53% of the vaccines being Pfizer, 40% Moderna, and then the 7% being the Johnson and Johnson. The Johnson and Johnson reality is an external reality that we just have to deal with, and it sounds like we are quickly dealing with it in a matter in which we can accommodate. And residents have to understand this is not at the making of anything that we've done. But I appreciate the quick response and sharing with us how we're planning on mitigating that moving forward and helping set those expectations. That's just really important, the level setting there. And, I think it has been said, but if it hasn't, for the 7% of our residents who have had the J&J vaccine, if anybody develops any of those symptoms from headache to abdominal pain or shortness of breath, please do contact your healthcare provider. And so that we can move forward here and make sure that everybody is healthy and safe. And, the only thing I just want to drill down on and explore a little bit more, Councilmember Raymer was just talking about the students, and we are going to have a conversation about summer camp. So it is absolutely topical for this day. And I've spoken with Councilmember Raymer, and he has talked about opening schools and trying to figure out how to accommodate our youth to have to be safe. Expanding upon that a little bit, we as a council, we in county government had advocated for a more equitable distribution. And the governor put a stop to that. The governor told us that we couldn't delineate between, to put it quite frankly, we could not provide doses to our Black and Brown community and our underserved community, more so prioritizing them over others. And now we're in a state where everybody over the age of 16 is eligible. But coming back to a goal that we all share, if we want to have vaccines provided to students, to high school students, can we look at schools and particularly those communities with higher farm rates and marry that data so that we can achieve an equitable outcome, one that we all know we believe, while trying to reach various other goals as well?
Well, I think that speaks to, a host of different strategies from an equity standpoint that, as we move through the age groups and we get to the younger population and explore, different strategies, whether it's, what Councilmember Reamer suggested, working with MCPS or a host of different things. I do think it's important to make sure that we are continuing to utilize whatever relevant factors influence equity for those particular groups. So I would be happy to, have a conversation with you to flesh that out a little bit more and to explore from our perspective how we could use that data to inform, allotment and outreach for doses for that younger population.
Great. I know a number of us would probably want to have that conversation, and it does utilize data that we can synthesize to this common goal and doing what we have long wanted to do. And so yes, let's definitely engage in that conversation. And then the only other question I have, a number of outdoor venues have been contacting me and contacting all of us, I know. And earlier in this conversation, we were talking about the dining capacities and the 25% capacity inside and the 50% capacity outside, making sure that everyone is distanced and so forth. Is there a point where we can allow larger outdoor venues that have stated that they would want people to socially distance with the use of vaccine cards? I don't like the term passports, right? But basically just showing that people they have been vaccinated and are healthy. Will that come into play here at any point in our processes?
I think many of us are waiting to see how the federal government will respond to that. And the tricky thing with even using vaccine cards or how passports, however you define them, is, I'll give you an example. I was asked yesterday, someone said, well, we have a meeting and everyone's been vaccinated. Can we do the meeting without face covering? And my response was, well, can you ensure that everyone has been vaccinated is outside of their 2-week period after they've received the vaccine and received it within the last 3 months, which technically is the criteria that the CDC has put forward. In the absence of that, you leave yourself open potentially for some type of transmission event because that falls outside of those guidelines. So I say all that to say that I think, yes, at some point that will factor in decision making. However, we don't have clear guidance from CDC or the federal level or state level in terms of how to factor that in appropriately.
What you just said is so critically important, and I'm going to ask you to say it one more time just so that we all understand it. What is the criteria once someone actually gets vaccinated, they're fully vaxxed, whether it was the one and done J&J or the 2-dose Pfizer or Moderna? Thereafter, once they get the shot, what are those criteria where the CDC deems them safe?
Well, the criteria are you've been vaccinated, you've received both doses or the 1 dose, and you are outside of you. So you're 2 weeks past your last dose for each of them, and that's when you are considered to be fully vaccinated, meaning that you have achieved that full level of protection against the virus for that particular vaccine.
Okay, and so that is really helpful, and that's where that's the rub, essentially, trying to make sure that while someone has a vaccine card or says that they have been fully vaccinated, we want to make sure they're outside that cautionary window and that it's taken full effect. Okay, very helpful. Thank you again, and certainly let's continue this conversation that's been raised here and raised by some other colleagues about equitable distribution for communities and particularly younger people while they are still tied to school. So thank you.
Thank you. Councilmember Novato.
Thank you, Mr. President, and thank you to the team. I have really enjoyed this conversation. I think there's just been a lot of really important information shared, and many of my questions have been answered. Of course, on a daily basis, we never know what it is that we're going to have to address, and so I appreciate how everybody, on very short notice, is able to pivot very quickly and use your expertise to bring important updates to our community. I don't necessarily have particular questions because, as I said, many have been answered, but I did want to share my, concern in terms of the role that we play vis-a-vis ensuring that the communication to the community and the decisions that we make are such that are addressing the multitude of issues and dynamics in our communities. And so what I heard today was that, number one, we continue to be concerned with the high risk of transmission category, meaning community transmission. It is something that we have to be mindful. I think I heard also, number two, that obviously we're still working 24/7 to make sure that our residents are able to pre-register, access the vaccines whenever they can. We all know that the Johnson & Johnson news this morning does present some challenges in that particular work. And so we have to do whatever we can to put forth the facts and make sure that our residents have the important information. And so I just want to caution all of us to remember that we have such a complex county, and that when we're talking about issues of equity, for example, and how do we craft our messaging and how do we, make sure that folks are getting pre-registered, et cetera, that our message has to be consistent. And so as we begin to address, Board of Health regulations, for me, it is important that we be as consistent as possible and that we don't send mixed messages, because the truth of the matter is that although we're very fortunate, and I think it's credit to this team right here, the reality is that we're still navigating this whole path. And I personally almost on a daily basis get to practice this challenge, with my young adult daughters in terms of just explaining what is it that we can still do, what we can't do once you're vaccinated, what happens. And they ask very important questions that I'm sure are also being asked out there in the community, because we hear it through our office constituent calls, and also through the conversations that we have with our constituents. So I just want to caution that I don't believe that we are at a point where we can be very effusive about exactly what will happen this summer. I think that we are working through all of this while understanding that we do still have some major challenges in some segments of our community where we have not been able yet to fully see the rates, for example, of vaccination proportional to the percentage of those communities. And I'm specifically talking about our Black and Brown, community. So if we begin to send some mixed messages out there, that might even work, I think, disproportionately work even more against this goal. So anyway, I just wanted to put that out there. I understand that there's just a lot of pent up, obviously, concerns. I understand what it means for us vis-a-vis our economy. But we will be going through a budget. We will be receiving some federal funds. We will continue to work through this. And I definitely hope that by the summer, we will all be seeing, a shift in the positive direction. But we have to be consistent. And so that's just my overall observation, having, listened to everything that everyone has said. Thank you for the communication regarding the J&J vaccine. We need to make sure that we are putting out there, as much factual information as possible, but definitely continue to troubleshoot as we go. So thank you, team.
Thank you, Councilmember Jawanda.
Thank you, Mr. President. And in my vigor of my last statement, I forgot to ask my question. So, this is probably to Dr. Gales, but I guess Dr. Bridgers or Dr. Stoddard could respond as well. There was some discussion about the vaccine pace, and especially with what we're dealing with today, that from an equity standpoint and from just getting more shots in arms quicker and vaccinating more people, that the time period between first and second shot should be expanded, right? The reason that we have the 3 to 4 week period is because in the clinical trials area, they were trying to get it done quickly, and it saved a lot of lives. But there's really not of any research on, is 3 weeks right, is 4 weeks right, is 6 weeks right, as far as in between. And what we do know that a first shot gets you a lot of protection, right? And we learn more about that each and every day. And so there are some who are arguing, public health experts, people much more smarter than me on these issues, that we should expand the time period so that we can take what is allocated for second shots in the 3 or 4 week time frame and give those as first shots, because we know that particularly as an equity standpoint as well, Black, Latino, low-income residents are more likely to be getting their first shot, and we can get to more of them quickly and target that. Is that something, I think there's an article I read in the New York Times today about this issue. Is that something that you all are aware of? Have you thought about it? And will we even have authority, or have you talked to the state about it at all?
So we would not, the schedules that we are to follow are dictated by the state in terms of the schedules that we follow. I mean, we've thought about those things. We've read the same articles. We've looked at that. I think it's unfortunately a slippery slope in terms of how that would be implemented. Quite frankly, from a logistics perspective, the time periods. So I do want to clarify something though. So the time periods within that are set between the first dose and the second dose have been studied, and so they were studied from the perspective of here's the optimal response based upon those research trials. That was the leading priority more so than, they were still trying to get it through quickly, but the time frames were set by, from the pharmacologic perspective. So yeah, I think that there are lots of options and discussions that have been had to think about how to increase the capacity, but as it currently stands, how we allot our doses within the time frame is shaped by the policies that we have to follow from the state.
And that's that 4 week, that's the 4 week period.
So the 4 week period the 4 week period for Moderna, the 3 week period for Pfizer, those have been determined, and that's what's been approved by the FDA and others for us to follow. And so, yes, the guidelines that we have been shaped by the clinical trials with FDA that have been shared from the federal government to the respective states.
Well, I would just ask, hopefully we're having some communication with the state. Maybe this is something that can be raised with MDH as, in light of this kind of increasing call. I know it was talked about in the context of Michigan, we all want to get shots in arms as quickly as possible, and we want to target them to where they're most needed. So similar to what Councilmember Glass was saying, and I think what we tried to take action on several weeks ago, we're trying to figure these things out. So I just wanted to raise it, but I appreciate that. And if you do hear more about that, please let us know.
Will do.
Okay. Thank you. Thank you, Mr. President.
Thank you. Nope. No further requests to speak. So let me thank everybody for that important update. It's very difficult time with today's announcement, but I think it's been very reassuring for everyone.